The Limpopo Department of Cooperative Governance, Human Settlements and Traditional Affairs says it has successfully completed a 15 million rand asbestos roof removal and replacement program, which serviced 1,500 residents in Seshego, just outside Polokwane, within the set deadline. The department began exploring the initiative after heavy rains and hailstorms that damaged some of the roofs of those homes in 2020. And as we know, asbestos is known to cause fatal diseases such as asbestosis, lung cancer and mesothelioma. Basikopo Makamu is the Limpopo COGHTSA MEC and joins us now. Good evening to you, MEC, and welcome. As you look at the scale of this project, are you satisfied with the work that has been done in Seshego?
Good evening to you, Iman and Wongiwe. Let me say that we are happy as the provincial government on the manner in which we executed the project together with the assistance of the HDA, which is the Housing Development Agency, which is an entity of Human Settlement and National Department. The time that we have put to remove, definitely the time that we wanted to complete the 1,500 or 1,500 units, we did it exactly on time, but also it was conducted in a manner that the contractors that we were complying with the regulations of how you should handle the asbestos, because you know that this is asbestos elements of roofing that we have or has been there in the previous government.
I mean, it is commendable, in this context where we're looking for accountability, that the project was delivered on deadline. Was it also delivered on budget, MEC?
Exactly the money that we have budgeted for to deal with the matter. Despite that, the fact that some of the elements, because we're doing the project for the first time, could not be provided for. Like you will know that there should be a specialized handling sites that will be able to deal with them. In this case, I'm told it's in the Val, in the Gauteng province. As Limpopo, we don't necessarily have a place where we can dispose those asbestos because there should be compliance in terms of how you do. But we have been doing that within the limit and applicable legislations on how we should remove. Yeah. What will also excite you, Eman, is that even if today you can go and meet the beneficiaries in Seshego, I have been there just to listen to them on how they feel about the projects. They were happy and accepting that government has been helping them because they were going through hell whenever rain comes because they were leaking, but also providing the health hazard to their lives. Yeah. And we have resolved that challenge.
MEC, well, not to be cynical, I did read, some of the responses. There was an elderly citizen who'd been living in the home for about 30 years or so who said that he could feel a marked difference in his breathing because the replacement project had been underway. However, there is a health risk associated with living in an asbestos structure for many years. And a lot of the research says that especially between the 20 and 30-year period, that's when people are likely to present with illness. So it could be possible that there are risks associated with this. And I'd like to hear from you whether you have seen, in the health facilities, people presenting with asbestos-linked diseases and afflictions.
I must be honest with you, Eman, that I was also asking people if there's somebody in the household who has been once admitted because of such diseases of a lung affection because of this. I did not get, but also they were telling me how when it is deteriorating because they have been long, that start to feel that they have got challenge in terms of breathing. Hence, we felt this. It's so important for us to continue to remove. Yeah. I must indicate that the 1,500 is still a drop in the ocean. We have done assessment together with HDA. Currently, we have got almost 10,500 units in the whole province that still have to receive that. And we still have to go look for a budget to make sure that each and every financial year, there is a certain number of the units that we remove and replace the asbestos. And that program, we are getting support from the minister. And I think one day we will have done it and make sure that there is no single house left with asbestos in the province.
Yeah, I mean, based on the accounting, and my maths might be off here, on the houses that you've done with the price tag involved, it's probably going to take about R1 billion that you'd need to cover that project to make Limpopo asbestos free, which is your strategic desire. How quick, I mean, reasonably, how much time do you think it's going to take, and how much time are we talking here, MEC?
Let me tell you one thing that I don't agree with people, and when that matter is being raised, we still have got backlog to just deliver shelter to people, housing. So part of the work that you do, if you were to focus on doing that alone, you will say you will need 2 years to finish the project.
Yeah.
But we still have got an obligation to build RDP houses, the so-called, they call it. We still have to share on the budget. We should be able to do some community residential units. We still have to do some social housing in the province. So the money that we may always be, we prioritize it, but I can assure you it could not be within 2-3 years. It will be more than that, because we still have commitment, and you will know the economy of the country is not having the outcomes desired by this government to make sure that we have enough revenue to offer for basic services, because these houses or this roof, we're doing it for free for our people, which
MEC, the line is deteriorating quite badly, but I think we've got the essence of what you were saying at the end there. Thank you for your time tonight. Basikopo Makamu is the Limpopo MEC of COGHTSA.